Hi, I'm Brian Finestein, CEO of St. Clare's Health, and welcome to Let's Talk Health. I'm here with Dr. Basil Numi. He's a pulmonologist here at St. Clare's, and our subject is treatment for healthier lungs. So, Dr. Numi, welcome. So, first question really is, initially, why are patients referred to you as a pulmonologist?
That's a very good question. Especially after the COVID-19 pandemic, the lungs and the lung health became a focus and a center of the public attention. A pulmonologist is a physician who is specialized in the diseases of the lungs. So same as a cardiologist who specializes in the diseases of the heart, the pulmonologist studied the lungs more in depth and more in detail to be able to diagnose the problems with the lungs. So a lot of people, when they show up in the pulmonary office, are referred to us by the primary care physician to identify the reason of their complaints, which could be a cough, could be a shortness of breath, could be a wheezing, or could be an abnormal finding on a chest X-ray or a CT scan of the lungs.
But typically, it starts with the primary care physician.
Exactly.
Okay. Now, another terminology question that our viewers may be interested in. There are pulmonologists and there are interventional pulmonologists.
Definitely,
can you sort of
correct.
talk about what that difference is and how we transition as a patient from one to the other?
Yeah, absolutely, yes. The interventional pulmonologist is a pulmonologist who is specialized in intervening on the lungs. For example, if there is an abnormal finding, a lung nodule or a tumor or a suspicious of an enlarged lymph nodes, and the interventional pulmonologist is the physician who performs procedures on these lesions or abnormal findings of the lungs. Whereas the general pulmonologist is the physician who makes the diagnosis and discover the findings and then refer to the interventional pulmonologist to make the intervention on the lung.
Now, you yourself are both, correct?
Yes, I am both, yes, exactly.
So a patient could be seen by you and you'll go through the options and you will actually be performing those interventions?
Absolutely, yes.
Our goal is to provide the highest quality care at St. Clare's. Can you talk about the services that we offer our patients?
Yes, of course. So recently at St. Clare Health, we acquired very advanced techniques and procedures and tools in helping the pulmonologists making the diagnosis of the diseases of the lung. So at St. Clare Health, we have a very advanced bronchoscopy suite with most advanced techniques in obtaining biopsies of the lungs and the lung masses and nodules, such as navigational bronchoscopy and endobronchial ultrasound. Also, we have very advanced pulmonary function laboratory. A pulmonary function test is basically a simple test. It's a breathing test that will compare the function of the lungs between the patient that we are seeing and healthy subjects. So this will help guide the pulmonologist in knowing exactly what's the reason of the patient's complaint. Also at St. Clare Health, we have an advanced sleep laboratory. And sleep is, I would say, the obstructive sleep apnea, one of the endemic diseases, and it's largely undiagnosed problem. So we at St. Clare, we are equipped to be able to make the diagnosis for this. We have a robust, I would say, lung cancer screening program with low-dose CAT scan where we can screen the patients and be able to locate nodules and follow these over time. We also have an advanced pulmonary rehab where we can rehabilitate our patients with pulmonary diseases and get them moving and feeling better and try to get better control over their health in general.
Okay. So there's a lot of services that we provide. I want to jump on each one of them and ask some specific questions.
Absolutely, yes.
So you mentioned about the low-dose CT.
Yes.
Can you talk to us, is that an intervention? How does that play out in terms of the treatment and the care?
Absolutely. So low-dose CAT scan is a modified CT scan of the lungs. The idea is we expose the patient to very low dose of radiation, so nothing majorly to worry about in terms of radiation exposure. And it's a screening method in knowing which one of these patients might have a cancer in the future. So it's a screening test to be able to identify and locate spots on the lung, what we call lung nodules, and track it over time just to check whether these nodules will progress into a malignancy or at time of first assessment and evaluation whether we need to intervene on it and take a biopsy. So it's an early detection of lung cancer.
Okay. Now, are there any particular patient populations that are particularly targeted for
Yes,
that?
definitely. Smokers. Smokers by far at the highest risk of lung cancer, specifically patients who smoked more than 20 years, at least on average 1 pack per day, and they are at age more than 55.
Okay, thank
Those
you.
will be the target.
Okay. Now, shifting gears a little bit, you also talked about technology, and you mentioned EBIS, you talked about bronchoscopy.
Yes.
These are interventions. Can you sort of tell us what the difference is between them?
So both of them are kind of endoscopic techniques. Both are considered minimally invasive procedures. They are not the same, they are complementary to each other.
Okay.
So the EBUS stands for endobronchial ultrasound. It's a modified bronchoscope that has ultrasonic probe at the tip of the bronchoscope, regular bronchoscope, where we travel in the central and large airway and look outside with this ultrasonic probe to locate enlarged lymph nodes or tumors in the mediastinum and the hilars, which are the part of the chest that are outside the lung in the center of what we call the mediastinum. Once we identify any area that is suspicious, we will be able to biopsy it with confidence using the EBUS, because we will be able to see our needle going into the tumor itself and collecting the sample from the exact intended location. As far as the navigational bronchoscopy is another advanced technique. As the name implies, it's actually a navigational system in the traffic of the lung. That's how when I explain it to my patients, that's how I tell them. So we extract the map of the airways from the CAT scan of the individual patient. We create a 3D model, and the system will tell us the target and the path. So basically turn left, turn right, until you get to your target lesion in the periphery of the lungs. So also it's an advanced technique. We have it here at St. Clare, and it's a very, very advanced procedure that we do here at the hospital.
So it's good to go from potentially one modality to another, depending on what you find.
Well, exactly.
Gotcha.
Exactly.
Now, you also talked about a sleep lab, and there's home sleep studies.
Yes.
And there's also in-lab, I think is the term you use.
That's correct.
Can you talk to us about the difference in when do you start at home, when do you come into the hospital?
Absolutely, yes. So sleep apnea is really endemic problem, and it affects all age groups. What happened initially that the young fellows, they were having difficulty going to the sleep lab and sleep one night over there to have their diagnosis made. So they decided not to go through the process of making the diagnosis, and this was identified as one of the reasons why this disease was really largely undiagnosed. So the home sleep study is a very simple device, basically. It's a device that is worn by the patient in their own home, in their own bed, and they sleep exactly the way they sleep on a normal day. So no change in their habits, no need to take a day off from work, and the device itself collects a tremendous amount of information. These information can be gathered, analyzed by a sleep specialist, and the diagnosis of obstructive sleep apnea is made to a certain degree of confidence. The in-lab sleep study is the gold standard in making the diagnosis. So it's the preferred way in patients who are old, who have chronic heart or lung disease. The patient arrives at the hospital, sleeps in a hospital room that is modified to look exactly like a hotel room, with a sleep technologist who watches multiple aspects of the patient's sleep, collects a lot of data, and also formalize what we call results of this sleep study. And these information are analyzed by the sleep medicine physician and create the diagnosis of obstructive sleep apnea and certain other parts of sleep where there are diseases rather than obstruction interfering with the patient's sleep cycle.
Now, when do you decide, is it sleep versus in-lab, or does one lead to the second?
To the second. So it is preferred for patients who are above the age of 65, who have chronic heart or lung disease, to receive the in-lab sleep study from the beginning. Whereas young patients who do not have any chronic medical problems, who are employed, busy, who cannot really take a day off from their work to perform the study, we can start with the home sleep study. If 2 home sleep studies fail, then we're going to have to go to the in-lab sleep study.
Okay, so it can be sequential.
It can be, yes.
Understood. Now, you also mentioned earlier we have a pulmonary rehab lab at
Yes,
St. Clare's.
yes.
What does that entail?
So the pulmonary rehab is a special gym with an exercise program tailored specifically to the patients with chronic lung diseases. The exercise focuses on certain muscle groups that we know as a pulmonologist. Training these types of muscle group will improve the patient's respiratory status. Lung rehab across all the lung problems have proven to be a very effective method in preventing readmission to the hospital because of a pulmonary complaint, in utilizing the health resources, decreasing the utilization of the health resources. Also, it improves quality of life, decreases the symptoms of breathlessness, and improves response to the treatments for the pulmonary medications.
Now, is there any particular diagnoses that you're more apt to use the pulmonary rehab lab?
Yes, COPD, chronic obstructive lung disease, pulmonary fibrosis, those are the major categories of patients that we see at the pulmonary rehab.
Okay, so I'm assuming that because we have the full array of services, it becomes easy as to why your patients come to St. Clare's.
Yes, yes, and at St. Clare actually we take pride in the speed that we can perform all these evaluations. So I promise my patients whenever I see them in the office for when they have a complaint about a pulmonary problem that within a week we should be able to run all the tests that are required, make a diagnosis, and start the treatment. Especially in lung diseases, time is an essence because the symptoms are shortness of breath. No one wants to live with shortness of breath. And we are able to provide this at St. Clare Health.
Thank you. Dr. Numi, appreciate your insight into, again, treatment for healthier lungs, healthier light.
Absolutely. Thank you so much.
So everyone, thank you for sharing the time with us in Let's Talk Health. Please look for future events that we may have. You can follow us on YouTube and Facebook, and other questions, please go on our website, stclares.com.